For some women, when they go into labour, the first thing they shut down is their digestive system.
Yeah.
It means something else is working. People can throw up if you're after eating. If you're hungry during labour, it means your digestive system is working. Again, it's like running. If you know when you run in a full stomach, you throw it up. Sometimes you're running for long distances, you actually need to eat. Listen to your body. If you're hungry, it means it's grand. Everything is working, so eat away.
But they used to not let people eat.
They used to let people eat, and that was to do with in case you need an emergency C-section. But now they tend to bring your own food to eat. If you're at it for a long time, you'd be starving. Starving. Okay, so take nutritious snacking. Yeah, and if your system is working away, that's grand. Freedom of choice to walk or move or not to walk or move during labour. This again where a good midwife will come in and help you.
Okay.
Again, I had friends of mine who got stuck. I had lack of process that happened, and 2 midwives were walking up and down the corridor till they got that baby out, and that's sometimes what you need. A good midwife will know whether to move you or not, okay? And again, go with your instinct, okay?
Yeah.
The change position and assume labour positions of choice. This is going back to just because you're private, you should not have to go up in a bed to give labour. If you want to be on all fours, you can. Minimal number of vaginal exams with permission to avoid premature release of membranes. If you don't want your membranes released, you don't have to. Okay. Child labour to take its natural course without references to moving things along. To use natural oxytocin stimulation. Natural oxytocin stimulation is clitoral or nipple stimulation. Knock yourselves out. In the event of a stalled or slow labour, nipple or clitoris, there you go, to be accorded the uninterrupted privacy to do so. We're too Irish for that, let's just admit it.
Too Irish.
Okay, to basically be consulted before any introduction of any medical procedure. No augmentation of labour via pitocin or stripping of the membranes without discussion or explanation of need, okay? If either companion allowed to remain throughout all procedures. So again, if you were having a C-section or anything like that, should be there, is it there? No, yeah, through all procedures, so he'd be there.
Oh yeah, sorry, yeah.
If I had the trauma baby in the event of a surgical procedure, so let's say worst case scenario happened and they had to knock you out to have a C-section, or sometimes what happens is if you hemorrhage afterwards from a big baby or from twins, or it just happens, bad luck, sometimes what they might have to knock you unconscious to bring you in for D&C, okay? You stay with baby and you hold baby to your skin and stay with baby till mammy is ready. It's just because a baby will bond with anything. As I said, a bond with an incubator, a bond with a blanket, it'll much better bonds with mammy and daddy. So it will bond whoever's going to make it survive. Remember I said the most important part, the dangerous part is afterwards. You have to get the placenta out, okay? What they do, what hospital standard is that they give you an injection into the thigh of oxytocin, and that cramps up the whole thing, gets it out in one go. Okay. That's what they normally do. I'm all for it. You'll have enough, because otherwise they're tugging down there and you have enough. Everyone get out of there, but no one will get out of there until they have the placenta. Okay. So some people have, I know, waited, if you're really into the whole natural thing, to have a natural placenta delivery, but otherwise just even give you injection, because once that's out then everything's cool. Okay. So when baby comes out, okay, head comes out, turns the shoulders to the left and comes out, yeah? Yeah. So baby takes his first breath. When it takes his first breath, the placenta starts to die and the cord starts to die, okay? So the placenta starts to die. The minute it takes its first breath, and we'll come on now, we'll see how long it'll take, okay? Immediate breastfeeding to assist in the natural placenta expulsion. I was telling you about that, but it's also great for just getting the womb contracting back to its normal size. Uterine massage to assist birth to natural placenta. Geez, they do that sometimes where they'd be pushing down trying to get it out if it doesn't all come out in one go. Extremely uncomfortable and painful because you start to do loads of work for hours. The next minute they're pushing the hell out of it. You're going, get away from me. So not nice. Oh, here we go. You can do your natural nipple stimulation to assist in birth to placenta if you want. No cord traction, pitocin, or manual movement. See, the pitocin is the oxytocin. So you can take that out if you do want the manual removal of placenta there, unless there is an emergency. That should be at the very end. You should have the same printout I have.
Next page, it's it.
Yeah, top of it there.
Oh, sorry, no cord
traction. Pitocin is the oxytocin.
So we actually do want
You do if you want. It's the easiest. I think personally, it's the easiest way of getting the whole thing out. And they're all. You'll see at the minute that's out, everything calms down, but nothing calms down until that's out. So this is an option you have if you really want to do it for whatever reason. Okay. Second best thing you can do is just wait until the cord stops pulsing. Because apparently this fabulous, wonderful blood then will all go into baby. Okay, so it's kind of like a boost first, basically. So it can take up to 30 minutes. The cord is very, very thick cord, okay? And you'll see it pulsing like that. And I remember Lana, it took up to 30 minutes to do.
Wow.
She's the only one got it. Everyone else got cut off. For people who work, I said anything works with their hands, especially farmers,
Well,
I
and
find are very
the
good.
blood and the gore, those kind of things,
Yeah.
you probably
Nothing but
know,
so. Yeah.
you know.
Yeah.
So.
He would be good hands on that
And
kind
he
of way.
tends to be very calm in general, I would say.
I'd say, yeah, you'd be fine. I mean, you don't have to be very unlucky for something to go wrong. Put it
Yes.
that way too.
Yeah, like
And-
the percentage of problems is probably quite low. in
Very
general.
low. Very low. I mean,
Yeah.
you'd know about it now if there was any kind of issues.
Yeah,
But I said a
yeah,
healthy
yeah.
mother with a healthy baby should just have a healthy birth.
Birth. Yeah.
And there's no reason why not. If you can keep the bad stuff away from you,
Yes.
which is sometimes the help, ironically.
I
Which is
know.
ironic.
Yes.
You think you're doing the right thing by going to hospital early and being minded.
Yes.
Hospital policy is an issue, money is an issue, the bed's an
Yes.
issue, how long they're going to
I
leave
know,
you there.
there's too
And
many
they
other
don't have a
variables.
say, like they have to get you out. They've been told you need to be out of that room in 8 hours, one way or the other kind of thing. And I mean, they're doing their best for you, but I'd say their hands are tired an awful lot.
Oh yeah.
So to keep that in mind, so as I said, labour at home, go to hospital, birth is always the motto we have for
Motto.
this.
Yeah.